This is a simulation of normal hearing, progressing to more and more severe nerve deafness, medically known as sensorineural hearing loss. In the progressively more severe examples, more severe ringing is added, trying to approximate what people with this condition often have. It is predominantly caused by long-term noise exposure, such as in loud workplaces or around lots of loud music. It is also caused by old age, generally over 80 to 90 years old, and also by ototoxic drugs that can damage the mechanisms of hearing. Unfortunately, the effects are usually permanent until the person dies. There is no cure for this condition. Furthermore, hearing aids often prove to be of very little value, if any, especially in more severe cases. It is very discouraging. Hallmark symptoms include unusual difficulty hearing in the presence of background noise, and also hearing mid to high-pitched sounds. This affects intelligibility of human speech, giving you the impression that people are mumbling and not speaking clearly. Such people can hear you, but they may not understand you, even if you speak very clearly. High-frequency loss often suppresses some consonant sounds, such as F, S, and T. In severe cases, these consonant sounds may appear to actually be missing. For example, ocean and lotion may sound the same to that person. The L may end up missing. Such people may have even worse trouble understanding women and children talking, due to their higher-pitched voices. Trying to minimize exposure to loud noises is your best defense against this very discouraging disorder. We will now start with normal conditions, using a high-quality synthesized voice, which is better than my own speech. We will then progressively worsen the conditions to simulate progressively more severe nerve deafness. Hello. This is May 12, 2012. This is a simulation of nerve deafness. You will hear the same recording at different degrees of nerve deafness. Hello. This is May 12, 2012. This is a simulation of nerve deafness. You will hear the same recording at different degrees of nerve deafness. Hello. This is May 12, 2012. This is a simulation of nerve deafness. You will hear the same recording at different degrees of nerve deafness. Hello. This is May 12, 2012. This is a simulation of nerve deafness. You will hear the same recording at different degrees of nerve deafness. Hello. This is May 12, 2012. This is a simulation of nerve deafness. You will hear the same recording at different degrees of nerve deafness. Hello. This is May 12, 2012. This is a simulation of nerve deafness. You will hear the same recording at different degrees of nerve deafness. We will now start with normal conditions again, but using my own voice, complete with a congenital speech impediment. We will then progressively worsen the conditions again to simulate progressively more severe nerve deafness. Things are even worse here due to my speech impediment now in the picture. The discouragement factor is now greater.
This is John Nozum from Brownsville, West Virginia. This is May 24th, 2012. This is a demonstration of nerve deafness. It will show you what happens and how hard it can get to understand. You will notice some of the consonant sounds not coming out. This is John Nozum from Moundsville, West Virginia. This is May 24th, 2012. This is a demonstration of nerve deafness. It will show you what happens and how hard it can get to understand. You will notice some of the consonant sounds not coming out. This is John Nozum from Moundsville, West Virginia. This is May 24th, 2012. This is a demonstration of nerve deafness. It will show you what happens and how hard it can get to understand. You will notice some of the consonant sounds not coming out. This is John Nozum from Moundsville, West Virginia. This is May 24th, 2012. This is a demonstration of nerve deafness. It will show you what happens and how hard it can get to understand. You will notice some of the consonant sounds not coming out. This is John Nozum from Moundsville, West Virginia. This is May 24th, 2012. This is a demonstration of nerve deafness. It will show you what happens and how hard it can get to understand. You will notice some of the consonant sounds not coming out. This is John Nozum from Moundsville, West Virginia. This is May 24th, 2012. This is a demonstration of nerve deafness. It will show you what happens and how hard it gets to understand. You will notice some of the consonant sounds not coming out.
So, if you continue to work in very noisy environments, with prolonged exposure to levels over 85 to 90 decibels, this is what your hearing will resemble, unless you use hearing protection. Shooting guns is even worse. Listening to lots of loud music, especially with headphones, is also a fairly fast track to permanent hearing loss. Protect your hearing.